Hi, my name is Sarah Deal, and my topic is on sudden death in athletes. Sudden death in athletes is rare but not unusual. Most common is sudden cardiac death, which is what we will be talking about the most. Occurs mainly with competitive sports or vigorous intensity, relates to genes, age, and sex, and this presentation discusses the articles, findings, and recommendations. The first article that I looked into discussed defining a true cause of sudden death in college athletes specifically, and out of 182 recorded deaths and autopsies, they found that 64 were related to cardiovascular causes, and the most common were hypertrophic cardiomyopathy and coronary anomalies. And so how does this relate to sudden death in athletes? It is the most common sudden cardiac death in athletes, and hypertrophic cardiomyopathy is the thickening of the heart muscle, and that can make it harder for the heart to pump blood to the organs that are being used during exercise, and this creates an abnormal pulse, which can lead to sudden death. Coronary anomalies are the reduction of blood flow, and this can produce relative hypoplasia of the coronary branch. And for this, athletes don't often feel symptoms until they are close to death, which is after excursion. On to the second article, it discusses sickle cell trait and how it can be associated with sudden death in competitive sport athletes. And this does tie into sudden cardiac death. In this article, 23 sudden deaths were related to sickle cell trait, and most of these athletes did play football or another type of competitive sport. And most of them lived in the South. 20 of these individuals lived in the South, where it is a lot hotter, and they were in temperatures over 80 degrees, and that also plays a part with sickle cell trait. And sickle cell trait is when red blood cells can be sickled during intense excursion, and what happens is it blocks blood vessels, and players or athletes usually experience significant physical distress, and this can lead to collapse and death after extreme intensity. With the third article, it also talked about how the main sudden cause of sudden death was sudden cardiac death, and they also talked about the use of pre-participation screening. They conducted a study to determine the effectiveness of a routine examination and ECG, and with this, they made it mandatory for a region in Italy to have routine examination and ECG, and the rates were very high in this region in Italy. And at the end of the study, the results showed that sudden death in young athletes did happen to decrease. So electrocardiogram is a test that measures electrical activity in the heart. It sends an electrical impulse that squeezes the heart muscle and pumps blood. This determines how long electrical impulse takes to travel through the heart, as well as measures activity to see if the heart is being overworked. Pre-participation screening, we know that as sports physicals. It is used to maintain health and safety of athletes, and if an athlete is not cleared, they are redirected to another sport that they might be able to do, or rehabilitation. And pre-screening is not just for the heart, it can also be for lungs, musculoskeletal, and concussions. Findings. So to conclude all of my research I did based on sudden death in athletes, we can determine that the most common death is due to sudden cardiac death. Hypertrophic myocardiopathy and coronary anomalies are most diagnosed, especially in younger athletes, and these are also harder to fine in pre-participation screening, which might be why there's so many deaths, is because they never find this before the kids even play. And pre-screening, even though I said that, pre-screening and ECGs are a good prevention method. The sudden cardiac deaths are more predominant in males, and the most common age of death in competitive athletes is 12 to 22, just because at that age they are doing more vigorous exercises. Heat and intensity of exercise are factors for individuals with sickle cell trait, and deaths are most likely to occur during or shortly after the exercise. Recommendations. So always be cautious of temperatures, especially when you're doing a vigorous workout. Drink plenty of fluids and gradually build up workout intensity for those with sickle cell trait. Keep track of your family medical history. If you have a mother or father with a heart problem, you should definitely be cautious of that. Schedule routine physical examinations or ECG if you know you have a heart condition. Ask your physician questions or notify them if you have any complications. And if something doesn't feel right, stop working out right away. Here are my references for my presentation, and thank you for listening.